Hello. Good afternoon. Good morning. Morning, sorry. Good morning. Medyo malaki-laki ngayon ang crowd, no? Uh, I am here to talk in behalf of my brother. Before I do that, I will also talk about myself because my brother now is a doctor, practicing doctor in Davao, and he's a surgeon. So before I do that, I talk about myself first. I was introduced to Max last June 15 with Prezi as my upline. Before that, medyo nahirapan siya mag-explain sa akin because I am one person very skeptical. Kailangan mo na may mga proof no about the supplement. So I asked her press if there is some clinical study. So she told me to go to BTC to listen to the meeting. So when I heard about the meeting, after the meeting, I know na about glutathione because first, even glutathione, very, very common. That's a byword na sa mga babae, no? Even the dermatologist, the hairdresser is using a lot of glutathione in the parlor. So, I believe glutathione makes us white. But the real glutathione per se is a very, very effective anti-aging product. But before that, I was also misled to believe that glutathione is only pampaputi. So, when I joined the Max, I started taking it myself. Wala akong maputi, but it made a very remarkable on me because my arthritis was healed. I was suffering from arthritis for quite a long time. When I still have my first baby, it was Katrina, I already have my stiffening on my fingers. So every time I walk out in the morning, I cannot move because my fingers are already stiffened and it's having an inflammation. So after taking a Max, maybe after a week or two, I observed that in the morning I have no more pains already and my stiffening fingers are softening already. So I was not taking anything except Max. So I told myself, Max is working in me. So I started to believe in the product. So after that, I was thinking of my brother in Davao. He is a very, very successful surgeon. But he is not practicing well because he is hampered with his movement. Since the time 20 years ago, he was already suffering from diabetes, and his lower extremities, the legs, are all already swollen. He cannot walk well, he cannot drive, he cannot stand long in the operating room. And sad to say, daghang siyang pasyente, marami siyang pasyente, but limited kayo ang iyang movement. Now, when I started taking Max and it works in me, I shared it to him. So I called him one day to try the product. So he said, "Oh sige, ipadala mo yan, just the idea na mahalinan ko." But, so I told him na better try this product, and he is one individual very, very hard to convince because he is a doctor himself, and Dr. Villarin says one of the professional very hard to convince are those doctors, especially practicing doctors, because of intellect. And they're so very intellectual. They will ask you so many questions. If you don't have clinical study, they won't believe in the product. So I told him, okay, I will send you the product and send you also the clinical studies for you to study and to read about the real thing about Max. So I sent him the product and I sent him the clinical study together with the CD, the video. So maybe after a few days, na-receive niya ang product, he takes it himself. He texts me. Ayun siya, please call me. So I called him long distance. And he told me, you know what happened to me now? Siya, ano sa mga yung produkto? Nga naman man siya nga, grabe, I can sleep now. No, you see? So, yung ko, that is just the initial result in you. Please continue take the product. So, after mga, wala pa less than a month, he texts me again to call him long distance. And this time, medyo na, I am waiting for more results from him. Kaya I know he is taking the product already. So, tawag ko. You know what he said? You know what he said? He called me Inday in our family, you know. My friends call me Rose. You know, Day, siya. I have to tell you something. I can walk now. Why? I've been suffering for 20 years. My legs are all swollen. I cannot do much. I cannot move. I have a hard time in the operating room. And now my legs has returned to normal. Ayan siya. So, being my brother, of course we love our brothers and sisters. Medyo kailangan ko ba kay, you know, I haven't seen him also for quite a long time. So, my place, my original place, I'm from Davao, like Dr. May Villarin. But I am not, I don't have enough time, you know, myself to visit my brothers and sisters. I spend most of my time here in Cebu. So when I heard him he's improving, kanang kailangan ganyan ko ay, because I was touched, you know, that the effect of mass in him is working. So pag humanan to, I told him, kanang okay na ka, siya nga, I am very much okay now compared before, because for 20 years I have been suffering. My lower extremities are swollen. I cannot walk. I cannot even drive. I have my driver here. And now I'm okay. I can walk. I don't have a driver anymore. I can operate. I can stay longer in my clinic. And I can attend to my patients well. So that alone, it is a blessing really. So I told myself, well, kung inunahan na malanggana ang result sa imuha, why not join Max? And it is also your opportunity for you. It is your moral obligation for you to your patient also to share the product, because you know that it is really working.
Yes.
And you will not fail, because you yourself is credible enough to make testimony to your patients that the product is working in you.
Yes.
So, doctors alone, karon dili na maglisod ka ni og kanang introduce the product, because they themselves are now taking the product.
Yes.
So, I know now nga dito si Presi ang kanang Eric was there in Davao, and they met my brother. Sa Tagum, he is working in Tagum. And the last thing he said to me, siya nga, Day, you know what happened to me? Kay, ang mga medrep ba, they're always there in his clinic to promote the medicine, no? They observe, Doc, are you using glutathione? Kay, nagkamis ang iyang kutis, and he looks pinkish. And he said to me, you know what? Once you are diabetic, one of the symptoms of diabetic patient is dryness of the skin.
Yes.
So that's what he was suffering before. And after taking Max, he noticed na iyang skin gani softens. Onya, pinkish na ron.
Yes.
And he is glowing.
Yes.
Kaya alam siya nga maulo man ko kay lalaki ko na siya. But it cannot be denied, because the effect on him is so remarkable. So I am also happy now that it's a blessing from God, and it is also our moral obligation to introduce it to our relatives, friends, and our families, our friends, no? Kaya the product is really working, and it's very, very good. So, everybody, lalo na mga babae, aging is inevitable. It happens to us, everybody, lalaki man o babae. But there is only one way na to slow down the aging process, and also live, feel, and live to the max.
Yes.